TV. Oh yeah. Unale we pledge with love and loyalty to we sweet mama salute. Now we all come together as well on. For tomorrow, now we gon' make salute. Any side where you there, it no matter. Sky where you be, it no matter. Anything you they do, it no matter. Oh yeah, it no matter. Now we putting up stronger one inside Sierra Leone, like a big quantity. Where breeze not a shade. TPP TV, Talking Points platform. Then they give you information about salute. Tune TPP TV.
Good evening and welcome to Talking Points platform. This is the program Health Corner, and Talking Points platform na the place for be for entertainment and education. Today na the program on Health Corner, we can discuss diabetes and also the risk where COVID-19 pose to people when we get diabetes. Well, today na the program for can help we discuss this thing better one. We don't invite a very distinguished doctor in the person of Dr. Saluba. Doctor, good evening and welcome to the program.
Yeah, good evening, Dr. Alpha. Good evening, listeners and viewers out there. Dr. Saluba, and I'm happy for being a guest tonight and talk on the topic diabetes and one of the the severe effect of COVID-19 with patient with diabetic contact with COVID-19.
So, well, doctor, we so happy na TTP here for can get you expertise for let you can help we and educate we people in both on this diabetes and also COVID-19. Well, doctor, first of all, people out there where they watch we, then go and know wetin na diabetes. In simplest term, doctor, help we understand wetin na diabetes.
Yeah, and once more again, listeners, I go greet you all. Good morning, good afternoon, good evening, and we're all welcome for listening to this wonderful Health Corner program today. So, and I want to make you understand this as a disclaimer. You know, diabetes not a very broad topic. So I go make them very short, and I go try to pick out just the main point, the main ideas, so that even the the non-medical personnel, people out there go able to understand within this diabetes disease is all about, and also the severe effect of COVID-19 with diabetic patient. So in a nutshell, where we talk of diabetes, diabetes is not a chronic disease. And this disease, they cause where person in blood, sugar glucose level, they high. So medically, what we try for talk where we see a patient or a person don't get diabetes. Okay. For example, now let's say somebody not get any idea about diabetes. So that is why you need to understand, say, diabetes now waiting. Now a chronic disease with a cause from anybody, you understand, where your blood sugar increase, you understand, when the level go high. Yeah. So I will put her in that simplest term for now.
Well, thank you very much, doctor, for that precise answer. I know say diabetes gets different type. We get different type of diabetes. We get type 1, type 2, gestational diabetes, doctor. So we need your expertise. Help we understand. Then different kind of diabetes, them waiting the mean, waiting at the difference, type 1, type 2, to be specific. Help we, sir.
Yeah, exactly, Dr. Alpha. You just said it on the brief intro. So when we talk of the type of diabetes, we get two main types. Yeah, we get the type 1 diabetes and the type 2, and followed with that of the gestational diabetes. But here, when we consider diabetes type 1, so this diabetes type 1, we can call them insulin dependent diabetes, or we can call them also juvenile diabetes. And the reason why, because 5 to 10% of all the diabetes we can, like, let's say, all diagnose of, you understand, it can happen between, let's say, for example, a child and also that of adulthood. That is for the type 1. And then the type 2, when we say the type 2, that one are the non-insulin dependent diabetes. Yeah, and this one, for example, now the diabetes we, for example, 90 to 95%, they account for older age people, and for example, also people making obese. Yeah, and also the third one we put as a sub, we not gestational diabetes. And this diabetes, it developed, let's say, as 2% to 5% of all pregnancies, for example, but usually it disappear when a pregnancy is over. So the gestational diabetes occur more frequently in, let's say, to make mention of, like, African Americans, Hispanic, Latino, and the likes. Yeah. So here there is very important thing that I want to explain just in a brief sense. You understand? Because, for example, when we say diabetes is what? It's when the body does not properly process the food for the use as energy. You understand? And most of the food where we eat, it turn into glucose or sugar for our bodies to work, to use for energy. So imagine if you not eat, the way to get energy. So the pancreas, okay, now an organ will lie near the stomach, and this pancreas, they make a hormone we call the insulin. So this insulin is very powerful, as in hormone. Yes, like chemical messenger. So the insulin, they help the glucose for get into the cells of the bodies. So what can happen when you have diabetes? Your body either doesn't make enough insulin or can't use its own insulin as it should, supposed to be. Yeah.
Thank you for that one, doctor. So if you permit me, doctor, for make a paraphrase you small, so we people them, we viewers they out there, the type 1 and type 2, basically type 2 they occur in 90% in adults. In most cases, na type 2 they occur in adults, and the type 1 most them na pan small pikin them, and of course the gestational na precisely between 2 to 5% of belle woman them can get that one day. All right.
Exactly, Dr. Alpha.
All
Exactly.
right. All right.
Yeah.
Thank you. So doctor, as you know, with every other disease, there must be signs and symptoms. Seeing the way the person go feel na im body, say, I know they feel well, I look sick. Or if you go hospital, things the way the doctor go see and not say this person they look sick. So in a nutshell, tell we when somebody get diabetes and they feel sick, wetin are then signs and symptoms here? Wetin the person go feel or wetin the doctor go see in that person, the way we go know say something he get diabetes before even something then do the diabetes test.
All right, great. Thank you very much, Dr. Alpha, for that question. Yeah. And I go try to put a hold on this part because like I mentioned, diabetes is not a very broad topic. And tonight we are not dealing with the pathophysiology or the path anatomy. Yes, we they deal with more of the clinical, the medical, and everything. But we want listeners out there for really get what we are up to tonight. And as the caption implies, diabetes and the severe effect within this COVID-19 time. So at this moment, I would like to focus more on the type 2, okay? And type 2, as I explained briefly, okay? Type 2 diabetes is like used to be known or called the adult onset diabetes. But something that we need to take note of and be reminded of, today more children are being diagnosed with disorders also, probably rise in childhood obesity. You understand? So when we consider the symptoms of this type 2 diabetes, okay, type 2 diabetes symptoms, one of the symptoms um, is increased thirst. You know, when you're thirsty all the time, unusual thirst. Let's say, for example, you're a person where you use for the drink 2-3 cups, you know, of water, and then all of a sudden, or let's say 5 cups of water on a daily basis, and then all of a sudden a change to that of like maybe 10 cups, or maybe instead of like, let's say 1 liter of water a day you drink, it changed to 2, 3, 4, you understand, and so on and so forth. So that now one as in grave effect sign, increased thirst. And the second one, frequent urination. You know, sometimes you go see people with diabetes, they urinate more than 6, 7, 8, 9, 10 times on a daily basis. That is a wake-up call. Something is getting wrong somewhere, or something wrong somewhere. Increased hunger. I mean, come on, your appetite just extreme. You eat something after a few hours or even less than, let's say, an hour, you have the appetite to go and eat. That is another wake-up call. Unintended weight loss, your weight just drastically fall down. Fatigue, you know, it's unusual for someone just feeling tired. You wake up in the morning, you're feeling tired. From your head to that of your feet part, you're feeling tired. And then blurred vision. And that is, for example, you're a person where you know the experience, say, like, let's say you look at certain object on certain object, and then you get that kind of like blurred vision, you know, like something not clearly seen. It's a wake-up call. Slow healing of sores, frequent infection, and sometimes, you know, darkened skin. Yes, and also within the armpit and the neck area. So these are signs and symptoms that, you know, link to that of diabetes type 2. But we will
All right.
hope, yeah.
All right, all right. I think there you have it, folks. If you they feel the doctor don't say if you they feel thirsty too much, always to the drink water more than normal. If you they lost weight, unexplainable weight loss, you don't know what to make you weight they lost drastically. You dey piss too much, you dey urinate fast. This na a wake up call. Na some of the signs dem. It can be say not to even diabetes, but if you dey experience such things, e good for make you seek medical advice. You see a doctor, healthcare professional. The doctor don tell you, there you have it. But doctor, statistics don show we say millions of people in the worldwide wey dey suffer from diabetes. Dem no even know say dem get diabetes, and some of dem no even dey feel dem signs and symptoms here. Now dey feel everything dey okay. But wetin are your advice to people wey dey lis ten with today, whether dem dey feel dem signs and symptoms here or not? But we know say statistics don show millions of people in dey out there, dem blood sugar level dey high, dem get diabetes or pre-diabetes. Dem no ever know, dem no dey feel that much any serious sick with signs and symptoms. Wetin are your advice to the people wey dey lis ten today?
Yeah, may fumble them and listeners out there, you know, the advice where I would give to you people out there is that once you start experiencing these symptoms, the one that I just mentioned, yeah, I feel say you need for contact a medical practitioner, go to the nearest hospital or a nurse. Yeah, you don't need for apply any form of folk, or as in, you know, home treatment where you not get any form of, let's say, you don't understand exactly, I mean, the way you system the work. Diabetes is like not something we people for play with. You understand? And the reason why you not for play with this because you weigh now diabetes type 2, sometimes it become asymptomatic, the way the symptoms then they show up in you. You go get them, but you don't know. You go get them, but you don't know. So once you start experiencing, I mean, then symptoms they are, may advise for you now for just go to the nearest hospital and seek medical as in checkup. And in that case, you go able for no say, yes, something wrong with my system. If whether your blood sugar don't stop, if whether maybe you need to control your diet. And also we need to understand these listeners out there, okay? This diabetes type 2, as I explained earlier on, now when the body becomes resistant to insulin, okay, that means the pancreas is unable to produce enough insulin. So waiting to happen, you understand? Another able waiting converts the sugar, the glucose, you understand, where you don't take in, because glucose not just a sugar, not the main source of energy, you understand. So that is why you need for right away go to the hospital and get a checkup.
All right. Thank you so much. That's now a very precise explanation for listeners them out there. But diabetes now one of the sick that we get so much questions and misconceptions and myth out there from people. Everybody gets a own story about diabetes, and I remember growing up and even till now, one of the things they will go hearing people and they say, oh, they hear people and they say now that, oh, if I eat boku sugar or if not drink boku sugar, not drink boku coke, you go get diabetes. Doctor tell you any truth to that? Say coke or plenty sugar you eat, they cause diabetes. Any truth to this?
Yeah, Dr. Alpha, thank you for that question. This is not great question because when we say is diabetes caused by eating sugar, I think that's like that not a huge as in myth. You understand? Misconception out there. Okay. A diet is high in calorie from any source. Let's say, for example, including the sugar, and this sugar contributes to weight gain, and weight gain increase your risk for type 2 diabetes. But that doesn't mean that when you eat too much sugar or when you eat sugar or something way sugary means say you go get diabetes. That is absolutely a misconception. And I want for our listeners out there understand, okay? For example, now there is a risk in when you not manage the content of within food intake. So we say the type 2 diabetes, for example, type 2 diabetes is not caused by eating sugar or type 1, you understand, but mostly the lifestyle factors. So let's just take one example. Let's say, for example, a Coca-Cola, you understand, just the small or the bottle Coke. It's about 12 ounces or like 40 gram of carbohydrate. And do you know what? That 40 gram of carbohydrate is the same as 10 teaspoons of sugar. So waiting at a wake-up call, waiting at a reminder for you is that you're taking too much of waiting carbohydrate into your system. You understand? You take too much of waiting this sugar content. So if you don't know, say you not a type 2 diabetes, you need for waiting, you need for curtail, you need for waiting, you need for shorten the way you they eat these sweet things. You understand? Because these sweet things, they are all form of like carbohydrate. So, but if people out there, they go with this misconception, say when you eat this, no, that is absolutely wrong. You understand? Yeah. The only thing you need for follow the precaution, the way you eating all this kind of food stuff. Yeah.
All right, doctor. Permit me again for paraphrase for we listeners then out there. In other words, you dey tell we say absolutely sugar, though we know say sugar bad, but e no get any correlation for say if we drink plenty sugar or coke, say you go get diabetes. Absolutely not.
Yes.
And the only risk we pose, as you say, now that if you happen say you get like type 2 diabetes, where your insulin level and they very low, way you know they able regulate you glucose now your system and all those things, then you stand at a greater risk for let your sugar level go up and like that, right?
Exactly. Exactly.
All right. So
Doctor, I not cut you. If I can paraphrase you, on the previous question, I
yes,
mentioned about glucose. Say glucose, not just not a sugar, and that is the main source of energy. And this energy is for the cells that make up muscles and other tissues. So the glucose comes from two sources: the food and your liver. And the sugar is absorbed into the bloodstream where it enters the cells with the help of insulin. So your liver store and make glucose. So when your glucose level are low, you understand, what thing they happen? The liver breaks down and it is stored the glucose into glycogen. Keep your glucose level within a normal range. So that is the main thing, you understand. The main thing here, people need to understand, say, the glucose not a sugar, you understand, and are the main source of energy for the cells that makes up muscles and also other tissues. Yeah.
all right, all right. Thank you. And we also know say a good as human beings, let we maintain a ideal body weight. Let we keep fit, we make sure say we not overweight, we not obese, or as we can say in Creole, we not too bump, we not too fat. But then again, we don't hear a lot say diabetes, overweight they cause diabetes. How true is this? Which correlation where being overweight, somebody bump a fat get with diabetes? Wetin are the link? Wetin are the correlation, if any?
Yes, basically, Dr. Alpha, being overweight, of course, yes, is a risk factor for developing diabetes. But other risk factors, like let's say, for example, family history, ethnicity, and age play a role. So unfortunately, people were overweight, now waiting, then get the risk for diabetes type 2. You understand? The reason being because then weight don't exceed the normal weight. And diabetes can cause huge death, you understand? So when you overweight, that's not a wake-up call. And for example, being overweight and get involved to diabetes is like you get weighting, you get a double chance for get heart attack and many other disease and other, you understand, disease will link to the normal body function. So the good news here is that managing your diabetes can reduce your risk for diabetes complication. Yeah, so overweight is like an extreme risk to that of type 2. So I advise listeners out there, you get forget a plan, okay? You get forget a plan. Let's say, for example, being involved in let's say activities like going to the gym, or you having a work, not like just sitting indoor all the time trying to, I mean, you not to do anything, you understand? You need for move, your blood need for circulate, you need for exercise. You can do that now, you compound, you can do that now, you parlor. Yes, it's very important for burn those cholesterol, those fat. And that is why people where you find out say obese, then get so many within health issues. You understand? They always can link to that of cardiovascular diseases like heart attack, high blood pressure, and you name the likes.
All right, there you have it, folks. A good for make una keep and I deal with. Make sure say you exercise regularly because overweight not only pose great risk for make you develop diabetes or get complications from diabetes, but heart attack and the like. So a good make people in the exercise, but exercise and overweight now another entire topic on its own. And by the grace of God, in subsequent program, we go make sure say we bring something about that for we fambul them so we can able explain and educate them in that part day. But doctor,
Mm-hmm.
we know say we get sick them where they transfer from one person to another, and sick the way not they transfer from one person to another. For example, where Ebola been kind of salo, we know say they transfer from person to person. For example, communicable diseases and all and the likes. And we get other sick them a lot again. We if you get them now you angry, get them you need transparent to your wife or you picking them house or to your woman. So tell me now which category where diabetes fall?
Okay. The question to that one, first of all, is no. As you mentioned, if this diabetes, as something with the transfer from one person to another, that's absolutely, like it's just no. Yeah. Although we don't know exactly why people develop diabetes and others don't. We don't know diabetes is not contagious. That is something where people need for know out there. You understand? And meaning it can't be spread from person to person. It can be spread through direct physical contact, like touching or kissing a person, or let's say, for example, like cold or flu. So diabetes not a contagious disease. Yes.
All right. Thank you for that. We don't know. Listeners out there and viewers out there, diabetes not the transfer from one person to another. So if you family you person get diabetes, not afraid, make sure say you give them the support and the love we necessary so then go able manage this chronic disease here. Doctor, tell me diabetes, how serious a disease it is? How serious diabetes dey? How serious it is? Where you rank am with other chronic diseases dem na the world. How serious diabetes is?
Well, doctor, this is a great question. Yes, diabetes now a serious disease. Yes, now a serious disease. Yeah, and like I mentioned, okay, tonight we more the focus on the type 2. Okay, the reason why diabetes now is serious disease and wake up call. For example, when you consider the type 2, okay, you try to look at some of these complication we type 2 link to, and it just make diabetes as something that somebody always need for be on their alert, checking. You understand? Like for example, your health status, your blood sugar. So one of the things then like the complication then nerve damage. You understand? Nerve damage. For example, the excess sugar. You understand? Where they don't absorb. You understand? Where they cause that numbness. For example, tingling, and also where you'd experience pain. You understand? And also like you consider the toes or fingers where somebody can get sore. We can happen mostly with type 1. Yeah, but most of the type 1 complication also linked to type 2. And then also another important complication that kidney damage. Yeah, diabetes, type 2 can lead to that of kidney failure. Yeah, where sometimes it can require dialysis, or kidney transplant. And the eye damage is very important. People need to understand out there. Say type 2, some of the complication, then we really make this thing a serious disease where people need for focus and people need for be cautious about. Eye damage, diabetes, they increase the risk of serious eye disease, and such as the cataract, and then also slow healing, where somebody you find out, say you go you go get a sore, for let the healing occur, it will take some time. And some people also can experience this kind of like skin condition, skin problem, bacterial and fungal infection. So listeners out there, you get to understand that say this a very serious type 2 disease, because all these complication will link to it is serious for the health.
All right. There you have it again, folks out there. We know they come for put fear into una, but we just want to raise awareness. Now this program, and in Health Corner normally we get a disclaimer. We know they come here for can show una how for treat certain sick or how for come pepper doctor. No, if you sick, make sure say you go hospital, you seek medical concern. Here now this program we just want to educate with people on the common diseases, the way they tongue and way the world they suffer through, and at the same time raise health awareness so people can go be aware of what's out there. So doctor, with that said, I want to ask you, how somebody go able prevent himself from type 2 diabetes, for example, or how somebody go able manage. I know earlier you don't talk about regular exercise, if even you compound any other thing the way then go able do for manage this sickness.
Yes, of course. That's very important question, Dr. Alpha, because prevention is very important. Yeah, you also mentioned we not go into any deep clinical talk here, because this is a health corner, and the best advice, you seek your medical practitioner. Yeah. So when we consider this type 2 diabetes, the healthy lifestyle choices can help prevent diabetes type 2. And that is true even if you have diabetes in your family, and something we adjust the reality. So now a healthy lifestyle, some of these healthy lifestyles include eating healthy food. Yes, there is one phrase, people look like the food way then they eat. Yeah, it sounds funny. Yeah, but if you're not a person where you too they eat a lot, how you go look like? You go look too extremely big. If you're not a person where not too they eat, no, somehow it's just like for fun. But here you get to understand the healthy lifestyle need for be number one. Eat healthy food. Healthy food. You get to choose the food where lower in fat, calories, fibers, vegetables, and whole grains. You get to involve into exercise, because losing weight, let's say 5 to 10% of your body, can reduce the risk of what? Diabetes. And that'll keep your weight what? In a healthy range. Yes. And then avoid being sedimentary for a long period. You have these people, they love this style. Some people, you see them like this, they don't get anything where then they're doing active things. You go see them always like just love that life for being lying, let's say, on the bed, you understand, eating anyhow, that's what I meant by when I say, the kind of like sedimentary, you understand, lifestyle. Yeah.
Thank you so much for that advice. The family out here on exercise regularly, and there is this saying, doctor, let thy food be thy medicine. I think now Aristotle give you that quote there. In other words, let your food be your medicine. If you eat well balanced diet, you eat well, food, vegetables, protein, you make sure say you dey eat well, then the food go serve as medicine and your body go live healthy. And if your food no be medicine, then at the opposite go happen. The medicine go end up for be your food. You go dey drink medicine every day in your life. So make sure
Exactly.
say you eat to the advice here way doctor don't say, and subsequent programs they will go bring other more doctors them for let una can understand certain things them and how for protect and prevent una self from them disease here. Doctor, thank you so much for this diabetes education where you don't can give we. But we go change a little bit. Now the same diabetes, but we want change gear small. We all know say from last year to now, COVID-19 don't they? They don't kill thousands of people all over the world in all the peak. Age, race, color, COVID-19 don't cause so much destruction to people in lives, livelihood, and even economy. But one can wonder, say, doctors in the tell we say people that we get predisposing diseases them, then they at risk. But first, doctor, what we want to know now people that we get diabetes, if they get a higher or a greater chance for get coronavirus, for get COVID-19.
All right. Thank you, Dr. Alpha. That now something huge. Yeah. Like I mentioned, say diabetes now a broad topic. We in order for like, we get into it, we could spend more than weeks. Yeah. But for today, we focus more on type 2 because this type 2 now in get linked to that of the COVID-19 the more. Yeah. So here, listeners out there, as we all know, say COVID-19, a new and potentially serious coronavirus, where the World Health Organization been done declare COVID-19 outbreak to be a public health emergency, an international concern. And as we all know, over 46 million people around the world have been known to be infected with this virus. So with regards to your question, okay, older people and people with pre-existing medical conditions such as the diabetes, the heart attack, asthma, appears to be within more vulnerable to becoming severely ill with the COVID-19 virus. And when people with diabetes develop viral infection, it can be harder to treat due to what? Fluctuation in the blood glucose level and possibly the presence of diabetes complication. So here, I want listeners to get the point that two reasons why the immune system they compromise. Two reasons. The immune system they compromise, making it harder to fight the virus. And that's what leading to a longer recovery period. And also that means a person will get diabetes, you understand? I mean, if it gets COVID-19, the immune system, they become weakened, you understand? Because the immune system, they compromise. So to your question, doctor, absolutely, we've known for many years, you understand, that patients with diabetes are generally at greater risk of developing infection, you understand? But that doesn't withstand that patients with diabetes, like because you are diabetes, you will likely get COVID. That is absolutely no, you understand? The case here, somebody will not get diabetes with you, we get diabetes when they of the same, discipline, forget diabetes. So here, all we need for understand, you understand, we just need for know say people who get diabetes get more risk because the immune system don't compromise, you understand. So that is why we advise listeners out there for always follow precaution and always seek medical advice, attention when you know you are diabetic because your system they compromise and that they weaken the immune system when like your own defense body, now you security, you understand. So the answer is no, doctor. Diabetic patients or people, be calm, be happy, be safe. You understand? You are just the same like people out there. But the watchword is that just follow your precaution and be watchful. Okay, as the COVID rules goes, you understand, washing of hands regularly, face masks, and also not like hugging, like get that distance, that's centimeter distance apart when you're in a crowded place, and also maintain a healthy lifestyle. Yeah.
All right. Thank you. Thank you so much. You explained that one. This so wonderful for we people out there. You will get diabetes. No afraid. No put stress for yourself. You don't hear it from the doctor. Live your life happy and live your life healthily. Just know say you get more reason for protect yourself as doctor don't say. Use your face mask. Keep the distance. Wash your hand. Your personal hygiene. Observe am because you already get a compromised system because of the diabetes. But then they don't mean say if you go outside, you go catch the corona. Just be wise, like how doctor then say, and be happy. And, live your life healthily. Doctor they always say. But doctor, let's assume now say somebody get diabetes, then they feel sick with the signs and symptoms of COVID, and possibly you don't get COVID. Waiting are you advice to such people?
You mean, okay, I get your question. So yes, a very important question. If let's say for example you feel ill, perhaps the symptoms might be suggestive of coronavirus, let's say such as a dry cough, a kind of persistent fever, or like you just generally not feel well, unwell, like you they get that kind of feeling where usually unusual. Then the most important thing here, first of all, you need for contact your health professional. Okay, whether if na a diabetes doctor, whether if na a primary health care nurse, or you get to talk with your doctor. But in general, the same rules apply for other illness. Doctor, you get me right.
I get you. I
Yeah.
get you.
So the same rules appear for other illness. The same. Let's say, for example, the same sick rules apply for all other illness. So you get to look after your blood sugar often times. You understand? And get yourself out of stresses. Sometimes you might need medication because the stress also is out there. We get stress hormones. When you stress, then stress hormones, then they themselves they release now your system and can end up cause some other complication in your system. Yeah. So you just no need for stress, because what thing they happen when you stress, the blood sugar, the tends for go up. You understand? And that is why you find out, say, one stress of course, another one is anxiety, and many people will be experiencing anxieties at the present time during this COVID. Some people is just based on anxieties. The listening to news out there, seeing so many publications about COVID, misconception about diabetes, and then within they happen, you start for stress. And then as you stress, your blood sugar to pump up. So many people will be experiencing the anxieties and the persistent time to look after your fluid balance. So drink plenty of fluid, unless in a case we are in, you have to, you need to contact your health care professional. Yeah.
All right, Fambulem, don't worry, be healthy, be happy. Then say you get this popular saying, don't worry, be happy, be healthy, be safe out there. No stress yourself, let all your hormones them go shoot up, your stress hormones go shoot up now your system and find more problem for yourself. So be happy. And we get every reason for be happy. As we all know, from last year 2019 to this year 2020, it don't be a very unusual year. We don't get lockdowns. We manage for open after several months. Some countries like Belgium and England then have done the lockdown, coronavirus don't kill thousands of people all over the world, it don't spoil the economy, it don't spoil the business. But this week we get some reason for being a little bit optimistic, as we all know a lot of companies them don't they try for make a vaccine. We get this company Pfizer and BioNTech. We collaborate, and recently, just few days ago, they announced say the vaccine candidate is about 90% effective for protect we against the COVID-19. And also, I think yesterday another company, Moderna, then say don't come out and say the vaccine candidate is 94.5% effective for treat we for protect we against COVID. So, but for let people learn more about this announcement, let we just watch for a few minutes this news.
The world's leading scientists have expressed their delight, along with a strong note of caution, following the news that a vaccine against coronavirus has proved 90% effective in early results. The vaccine, developed by pharma giant Pfizer and his partner BioNTech, has been tested on 43,500 people in 6 countries, with no safety concerns being raised so far. England's Deputy Chief Medical Officer, Jonathan Van Tam, said he was hopeful that the first vaccine might be available by Christmas and there would be a much better horizon, in his words, by next spring. Prime Minister Boris Johnson said that one significant hurdle had been cleared, but there were several more to go. And some experts were keen to point out that this announcement was made on the basis of very early analysis, with the vaccine not yet formally approved. Our medical editor Fergus Walsh reports on the optimism and the caution which greeted today's news.
This is a huge day for science and perhaps the world. For the first time, a COVID-19 vaccine has been shown to protect against the disease. Plenty of caution is needed, but the preliminary results of the Pfizer-BioNTech trial are highly promising. There were more than 43,000 volunteers on the trial, which began in July. Half got the coronavirus vaccine, half a dummy or placebo jab. Interim results showed 94 of the volunteers fell ill with COVID-19, nearly all in the non-vaccinated group. As a result, Pfizer says the vaccine is more than 90% effective.
It's such a great
Yes, doctor. What do you make up of this news?
Well, this is very incredible. This is amazing news. Yeah, just a reflection. When you look at the way the science and technology things they happen, it's like everything they modern. Okay, this is not a welcoming development for COVID. Yes, this now a situation we are in, we need to applaud these people. You understand? Because the time at which, these people then try to put, that effort, forget this vaccine, I feel say is just mind blowing. And we give thanks to God for that, because we believe, say, these vaccines now for protect people out there, you understand? And not just the United States, you understand, but developing countries too, and all over the world for protect the population. And really, I also go like for give, a huge rounds of applause to the Moderna, you understand? The video where we don't listen to already said, one of the huge, largest American biotechnology companies. Yeah. And then prove the efficacy of these vaccines, as in like, the reality of these vaccines and the effect where these vaccines go show. It's just mind blowing. Yeah. So that is 94.5%. 95, that is effective in the preliminary analysis. And as we all know, as of to date, the total death of COVID-19 is 1,332,390. That is the total death reported worldwide. And the most new cases as of today is 166,045. And then the new cases, 535 1,993. So I feel say, we just need to give a huge hug to these two great, as in pharmaceutical company, the Moderna and the Pfizer. 94%, I feel say, this COVID-19 go come down into the footstool of the world out there, so that people go out again and life go be happy for people. Yeah. And we also appreciate the medical personnel, the scientists then involved into this work, It's a kind of collective work, Yeah.
Yeah, that's not a very, very great point. And as you don't give me a very, very staggering and shocking statistics of the amount of people that we don't get infected only today worldwide with COVID, and people are now we in millions, 1 million or more we don't die. I mean, so we can only say a very, very big kudos to Pfizer, BioNTech, Moderna, and so many other companies that out there
Yeah.
then they non try for develop them vaccine here in a very, very fast pace and speed, because normally we know say vaccine and they take years for develop, but
Exactly.
we only hope say as then developed nation here don't almost at the point for produce en mass the vaccine here. We go only hope say they give a helping hand to developing nations them, so we self go able to protect we self. So with that said, doctor, we so much thankful na TTP TV here for when you accept the invitation today for come share with me and we listeners and viewers them out there your expertise. Thank you so much.
Yeah, thank you to Dr. Alfer.
Okay, you always welcome, and we hope forget you again very soon.
Oh yes.
We're not saying a busy man, but we hope forget you very soon.
As always, I mentioned that I only go talk on the type 2 because that's the one we linked more to the COVID, as in, frightened and stress for people out there. And this is not a hell huge topic. We go take days. So I'm always welcome and open for be part of,
All right, all
the
right.
health corner.
All right. God bless you. You're always welcome to TPP.
Thank you,
hope.
Dr. Alfer. God
So,
bless you.
Fambulem, una don't listen to this diabetes and the risk where COVID-19 pose to people when are diabetic. So, we can only hope una take the advice here una don't get today in good faith. And if you find this video interesting, make sure say you share them so that it go reach boku other people them, make them safe learn and understand about the sickness there. And make sure say you drop a comment below now the comment section. Explain to we, tell we waiting next you are about whose disease next you go allow talk about, because una input very, very much welcome. Now for una we they do this program for we people them out there. So we appreciate all una input, una likes and follow. And for that they help we for grow. So we encourage you to make una go na YouTube and subscribe to Talking Point platform. Na free. Just go on YouTube, Talking Point platform. You subscribe na free. Follow we at Instagram, Talking Point platform. Follow and like the Facebook page, Talking Point platform. These are the hope of education and entertainment. Until we meet again, probably on Sunday, stay blessed, be happy, and stay safe. God bless you all. Take care.